Hi everyone, we're going to learn how to do a swallow screen today. The swallow screen is a Joint Commission expectation and part of the evaluation of every stroke patient that comes into the hospital. It's being done all around the United States in both primary stroke centers and comprehensive stroke centers prior to putting anything into a patient's mouth to screen the patient to make sure of their swallowing safety. So the things that you're going to need to do to gather in order to do this screen is you need a glass of water with 3 ounces of water in it, you need a spoon, and you need the patient's medications. So to begin, take the swallow screen and take a look at it. Here's an example of the swallow screen. The first 10 boxes on the swallow screen are exclusionary criteria. If the patient, for example, has a tracheostomy, is having trouble sitting up straight, is mute, or unable to follow directions, if the patient is having trouble managing their own secretions, their own saliva, then you know that the patient is probably not a safe swallower and they have failed the stroke screen the swallow screen at that point. So please take a look at the last page of the swallow screen and you'll notice that there are a couple boxes here, and if the patient has any of those 10 criteria, the patient has failed the swallow screen. And that you would report this to the physician, and then he would determine an alternative method of feeding, such as an NG tube, keeping the patient NPO, or giving rectal medications. So to begin, you would look at the patient and make sure that the patient, like Jim here, is able to sit with his head upright, and he is. So that is one thing that you would need to have as evident before you'd ever even begin. The next thing you would want to do is explain what you're going to do with the patient. Jim, we're going to test your swallowing ability today. Is that okay with you?
Yes.
Okay. So we're going to look in his mouth and make sure that his mouth is clean. And if it's not clean, you need to take a swab and clean out any food particles that might be left behind, because you certainly wouldn't want to force these down into his trachea should that happen during the screening process. So Jim, let's take a look. Let's see if your mouth and his mouth does look clean. So there's no need to clean his mouth. We can go ahead and proceed. The first thing you want to do is you want to have the patient, if he's capable of holding the glass of water and the spoon, and Jim is, to have him take the glass of water and the spoon in his hand. And then the first thing we're going to do, Jim, is I'm going to put my hand against your throat, and I'm going to ask you to try to swallow. Try to make a swallow motion for me. And I'm feeling for movement, and I am feeling movement. I've got my fingers at the base of his tongue, and I'm feeling laryngeal elevation. I'm feeling his body actually move, so he does have the ability to swallow. So now let's see if it's a safe swallow. Jim, the first thing that we're going to do is I want you to take the teaspoon in the water and take a teaspoon of the water and swallow it for me, please. And while Jim's doing this, I'm watching. I'm watching that he's actually making the swallow motion and not holding the liquid in his mouth. I'm watching that he's not choking or coughing on the water that he's taken in, and that the water isn't running out of his mouth. Jim, I want you to try to say, ah.
Ah.
Very good. Okay. Everything's going along just fine. Let's take the second step, which would be another teaspoon of water. So Jim, go ahead. Swallow. Okay, a second good swallow, no coughing. Jim, say ah.
Ah.
Okay, and try it a third time. Swallow. Great, and say ah.
Ah.
Okay, Jim's voice quality is fine. He's passing the swallow screen so far, and so we still aren't finished. The next thing, Jim, I want you to do is I want you to take a sip of the water. And swallow. And everything's going along very well. He's not having any problem with choking or coughing. He's not feeling the need to clear his throat. And the next step then is to say ah.
Ah.
Okay. And now the last step is to drink the water. So I want you to drink the 3 ounces of water. I want you to drink it all together and chug it down. Okay, there was no problem with that. He drank it safely. He didn't have any problems with the water running out of his mouth. Jim, ah?
Ah.
and his voice quality is still good. Jim has actually passed the swallow screen. So you would go to the last page of the swallow screen and you would mark him as passed. You know now that Jim is safe to have his medications given by you, and he's safe for water. To have a further evaluation by a speech therapist for a swallow evaluation is different than a screen. Nurses will provide a screening. A speech therapist does a more detailed swallow to make sure that the patient is safe for his diet and so forth. Thank you very much.